I'll just repeat that. Sorry, I started talking before I pressed record. We are recording today. So welcome to the American Evaluation Association Research Technology and Development Topical Interest Group. So this is the first of a webinar series that we are going to put on to share best practice and some good evaluations that we are aware of. Today is the first in that, and it will be translational research evaluation, evaluating 10 years of the UK Medical Research Council translational research portfolio. And we're happy that Dr. Ian Viney of the Medical Research Council, the Director of Strategic Evaluation and Impact, has agreed to present and explain to us today his recent work. As this is the American Evaluation Association RTD TIG, I just have a couple of things that I would just like to highlight for you all here. The first is the call for proposals. So Evaluation 2020 will be held this year in October in Portland, Oregon. The theme is How Will You Shine Your Light? And the RTD TIG has also put together some particular themes that we would be interested in people putting forward proposals for review. So I strongly recommend that you click on the link, and I will put this in the chat as well so you can download this. We also have an RTD newsletter. If you're interested, you can sign up at the link on the page. Similarly, our LinkedIn group, and we have our own webpage, which includes the call for proposals as well as other useful and interesting information. And then finally, you can download the link to the publication upon which today's webinar will be based at this link here. And again, I'm going to put this in the chat so you can download it and look at this later if you would like. My name is Gavin Reddick, I should have said. I am a program co-chair for the RTD this year. And at this point, I'm going to stop sharing my screen and pass things over to Ian Viney. Could I ask that you mute yourselves during the talk? If you have some questions, feel free to drop them in the chat, and I will keep track of them. But the plan today is for Ian to talk and then have scope for questions and discussion at the end. And so without any further ado, I'm going to transfer over to you, Ian.
Okay, thank you, Gavin. Can you hear me, Gavin?
Yes, I can hear you.
Great, excellent. So I'm assuming that everybody else can hear me as well. So thank you very much indeed for the invitation to speak to you today. As Gavin said, I'm Director of Evaluation at the UK Medical Research Council, where I've led our analysis and evaluation programme since 2007. So just to give you a little bit of background, the UK Medical Research Council is the UK's largest funder of, largest government funder of basic biomedical research. And since 2018, the MRC has been part of the new UK Research and Innovation, which brings together 7 research councils plus organisations that provide funding to universities and to businesses as well. So in all UKRI expends over £7 billion a year on research and innovation in partnership with academia and industry, and as I say, is comprised of 9 leading academic and industry funding councils. And the MRC is funds about almost £1 billion a year of research, biomedical research. So I want to move quite swiftly through some of the slides so that we've got time for questions. I'm going to start with a little bit of background, move on to how we prepared for the study. This was a large mix of methods that we applied to looking back at the last 10 years of support for translational research. And I hope to give you a flavour of the results from largely from a large set of interviews with researchers, but there's also econometrics and bibliometrics and other techniques in there as well. So I'll finish off obviously with our conclusion and a little bit about what we intend to do next in this area. So just to give you a little bit of background, 10 years ago, actually the image on the slide here is an article from Nature referring to the then NIH director Elias Zerhouni's review of basic research. And that had a similar conclusion to a major review of health research in the UK, chaired by David Cooksey, often referred to as the Cooksey Report, which had highlighted that there was a serious problem with what was referred to as the Valley of Death, the first translational gap. And we just were not capitalizing on the excellent legacy of discovery science, and important advances were not being pushed or pulled through to market and patient benefit. And particularly, as that was very much followed by the economic crash in 2008, 2009, that attention was also placed on aspects of the economy that could be stimulated to provide longer term recovery. So a lot of interest in how do we translate medical research into patient benefit. So what was the MRC's response? Well, the MRC responded by introducing an innovative set of programs, new research funding programs, and new government funding was allocated to the MRC and other funders to deliver more innovation into healthcare and to capitalize on that excellent discovery science. In fact, the slide here refers to the then Science Minister, David Willetts, commenting on 300 investable opportunities that the MRC had identified from its portfolio. And that evidence helped us launch what became the Biomedical Catalyst, which was a brand, an umbrella that described both the MRC's and Innovate UK's investments in translational research. So I won't go into a lot of the detail of this, but the aim across a large number of funders and charities, both government funders and charities, was to create a continuum of funding across the translational research pathway. So we have MRC being very much the lead for taking things through from basic research through into the experimental medicine space and early clinical trials, whereas our colleagues from the Department of Health in the National Institute for Health Research very much led on taking things through late clinical trials and eventually into adoption into the health service. And there was also the introduction of various oversight mechanisms. So there was a new Office for Strategic Coordination for Health Research to help coordinate the activities of both MRC and the Department of Health in this space. So we've invested a lot of extra public money over the last 10 years, and we very much wanted to see what had been the benefits, and particularly to look at recommendations for the next 10 years of funding in translational research. So we embarked upon what became actually the largest evaluation that the MRC has ever commissioned to look in detail at the last 10 years of MRC support for translational research. So what we wanted to gain from this evaluation was an understanding of what had resulted from, particularly from our directed translational portfolio. So all that extra funding that we had invested with the specific objective of improving, accelerating, expanding translational research? And also, could we understand what impact that, for us, quite considerable extra funding, but in the scheme of things, quite modest extra funding for biomedical research, could we detect the impact that had had on the whole research landscape? And indeed, in looking in detail at projects that we'd supported, could we begin to identify maybe determinants of performance? What were useful indicators to use to be good proxies for translational success, if you like? So again, I won't go into a lot of the detail of this slide, but it's just to highlight the fact that we had at least 14 directed mechanisms for funding over the last 10 years. And they had started and stopped at different times. There had been different amounts invested. So this was quite a complex portfolio to take a look at. I guess 2 points to take from this complex situation. One, that with 14 initiatives to cover, we decided to group these into what became 4 categories. So first of all, there were those projects that were largely about progressing a new intervention down that development pathway. It was about a product, and those we termed focused projects. Then there were those projects that enabled translational research, so produced underpinning resources or tools to help translation. And then we had a category of broad projects, and these had qualities of both product development and the sort of methodological underpinning resource development. So we were a mix of both. And we did also treat our methodology programs separately. So we had also a separate look at methodological projects. And secondly, we had to take a decision over what projects to include in our analysis. And with 10 years to look at, we decided that we clearly wanted to include completed projects and indeed skew things towards projects that had completed earlier in that 10-year period, because we really wanted an opportunity for us to detect outputs and outcomes from those projects. So we then we constructed, and this was quite heavily drawing on a literature review that I'll mention a bit later. We drafted up a logical framework for translation. This isn't, you'll see similar logical frameworks in other evaluation projects. This is to give us a framework, a theory of change, if you like, for helping us with the evaluation study overall. And we did find it extremely helpful to have set out this framework and to have discussed what should be the expected causal links between processes. It helped us design discussion guides for the many interviews we had to undertake. It also helped us, as you'll see later, in drafting what we call outcome flowcharts when we had some results from those interviews. So, this isn't, as all of you who know, I'm sure, a lot about logic models and theories of change. This is about setting out a structure to help us with the evaluation. And it immediately told us that we were right to distinguish between enabling and focus projects, because there were a few things that we wanted to take notice of in those enabling projects that weren't there in the focused type of project. So we also wanted to sort out in some detail what had we invested in translational research over the 10 years. And here it's noteworthy that what we did do was we tried various approaches to identifying translational research outside of our directed program. So here we've got about on the graph about 538 million pounds of investment through our directed initiatives, those 14 initiatives that I referred to. but there's well over, well, almost £1 billion of other translational research going on across our portfolio. And the way that we identified that amongst the almost £5 billion of investment is we used text mining approaches to identify projects that had abstracts in which there was a clear expression of an intent to translate. So that's the way we distinguish between all projects in our portfolio, and to say those that had some sort of translational interest. We also looked at the portfolio where, as say, we'd identified this translational intent, and we looked at subsequent outputs, because we collect feedback on an annual basis from all of the projects that we support across our portfolio over the long term through the Researchfish system. And so we could refer to the Researchfish dataset, and it was quite encouraging to see that those translational outputs, things like patents, like spin-out companies, like funding from the Department of Health to do clinical trials and so on, those kind of indicators that there was translation going on in those projects correlated very well with those projects that we had identified as having translational intent at the outset. Wasn't perfect, but it was certainly encouraging. So we have this working definition of a translational project in the rest of our portfolio. And I suppose the surprise from this analysis of our portfolio was that the level of projects with some translational intent had been pretty stable across the 10 years. So the way in which we had built up our support for translation had been largely through our directed portfolio, these strategic initiatives. And so it was surprising to us that there hadn't been any kind of scope creep across the rest of our portfolio. There'd not been any greater support for translational research. It had all been successfully channeled through our directed portfolio. So, as I mentioned before, we also conducted an extensive literature search, and I won't elaborate on this, but we basically found that there was very little help out there in the published literature regarding benchmarks, comparators, or good examples of translational research evaluation, and we certainly looked quite hard for that. We even approached other significant translational research program funders for data and metrics and other insight that they may have gathered. So is probably the first to take this sort of approach across a reasonable sized translational research portfolio. We also did some citation analysis. So we contracted science metrics through suppliers for this this evaluation to carry out some bibliometric analysis, and this largely confirmed for us that that translational research had just as good a citation impact as the rest of our portfolio, and this is rather similar to results that have been found just recently, actually. NIH bibliometric analysis of its translational portfolio. And I suppose the surprise here is that publication is not the primary driver for projects in translational research. They're primarily, obviously, focused on advancing products down the translational pathway. But we found that that they were publishing in just as highly cited papers as the rest of our portfolio. But I think rather more interesting use of the bibliometrics was to look at whether you could find citations of the papers arising from these projects in clinical guidelines, in patents, and indeed in publications associated with clinical trials. And again, our data was, we applied these same approaches to a portfolio of grants from Wellcome and from US NIH, and found fairly similar results across the board. But this was again another useful tool for us to look at outcomes from translational projects. So in setting up our evaluation, we established an expert advisory group because we thought from the outset, and it proved to be right, that we would really benefit from a set of senior representatives from academia and from industry who could challenge us on the results and comment on the development of the methodology. And as I've mentioned, we were also supported in this work by a fairly significant collaboration with Ipsos Mori and Technopolis Group. And the way in which this work fitted into the MRC governance was that the results were reported and discussed in an interim way with our MRC Translational Research Group, who are responsible for funding our translational research grants. So the senior people involved in those groups are on the slide. So the results. The major piece of this work was to interview researchers who led around 250 translational projects across our directed portfolio, but also a sample from our non-directed portfolio as well. And we selected those projects to provide a good sample across the initiatives, weighted for the relative investment we had made in those initiatives, but also, as I've mentioned before, weighted towards those projects that had finished and finished early in the 10-year period. We found it extremely useful to use the Researchfish data to ensure that there was a mix of projects that we had prior knowledge of some evidence of progress, but also those projects where we had no evidence of progress. We wanted a mix of projects that would be translational successes and potentially pick up reasons why things hadn't progressed as well. The logical framework allowed us to, or supported us in developing a very detailed discussion guide with our enabling, broad, and the methodological project as well. We piloted these discussion guides with our expert group, and we made sure that the interviewers were very well briefed on our portfolio, the design of it, the objectives of it. And each interviewer was required to read a research pack that we had put together for each research project. That included the original, or extracts from the original application, but also Researchfish data on outputs that have been reported to us. And the interviewees were sent a brief setting out the main areas of inquiry. These interviews typically took an hour, and actually there was probably an hour and a half or so of preparation. They were recorded, transcribed, and then coded against an extensive coding framework using NVivo software, I think was used to support that. So some results from these interviews. So we had established a framework for looking at the stages of translation for each project. And what we did is we used the interviews, and the interviewers were briefed on this, to note the stage of development that the project was at when the application was made, at the end of the project, and by the time of the interview as well. So this allowed us to verify in detail the progression of projects where we had interviewed the project leads against these defined stages. And we found that this gave us good evidence that 60% of the projects had progressed at least by one of our stages. Now, I think that that's good evidence of progression, but clearly these stages are not equal in the effort and resources required to move from one stage to the next. I've just highlighted in this graph on the slide the fact that 30% of projects at the end of the project identified that they were doing some clinical work, whereas projects at the start of their tenure, only 10% of projects started from this stage. Of course, a 60% progression means that 40% had not moved enough to be categorized at the next stage. But I think this was probably the best evidence we'd ever come across that things were at least moving down the translational pathway. And of course, as we'll look at later, attrition, so identifying projects that should be closed or are dead ends, is also quite an important part of supporting translational research. So this slide identifies data from our interviews. We were also able to use a different indicator to look at generalizing this across our entire portfolio. So we'd looked in detail at about 250 projects using interviews and looked at this progression data. What could we do across our whole portfolio? Well, in this case, what we did is we used reports of follow-on funding as a proxy measure for translation. And so we could identify where projects had secured funding for follow-on work, which clearly showed that the work had moved beyond the MRC's remit. So we're a discovery science funder, as I say, funding things up to the experimental medicine stage. Those projects may well secure funding for a later stage clinical trial, or indeed funding from industry. And in these cases, we scored these projects as being having moved beyond the MRC remit. In these cases, we could validate this using the interviews that we had done. In this case, we could look across our whole portfolio, and we felt with reasonable confidence. And using this measure, we saw that around a third of MRC's directed translational projects had progressed beyond our remit. So this is much more than just moving one translational stage. And that was much higher than projects outside of our directed portfolio. So this gave us a good indication that by providing directed funding, by managing these projects through these strategic initiatives, we were accelerating ideas through the translational pathway with a good degree of success. We could use the interview data to, as I mentioned before, build a flow chart which showed, and our report has these for many of the initiatives that we supported, which shows the outcomes from the projects where we had detailed interview data. So we could show via these flow charts the fact that some projects had reached a dead end, had been identified as clearly unviable, and indeed 18% of developmental pathway funding scheme projects ended up as being identified as unviable. But 36% of these projects continued all the way along to outside of the MRC's remit. And a mere 7% of projects, only just 5 in this interviewed subset, had good evidence of limited adoption. So had produced a product that had then got taken up by industry or adopted into clinical practice. But we have to recognize that 10 years and the fact that only those projects that we funded early in the 10-year cycle will have had a reasonable amount of time to develop outcomes. So we feel that there's probably going to be a lot more outcomes and a lot more translational success in this portfolio in future. So I need to move along because time is pressing, but we also had some interesting indications of the success or otherwise of the risk appetite that MRC had shown. So here there's some results where we looked at individual projects, whether the projects had achieved their primary output, the intended output, or not. And what was interesting was that for those that that achieved nearly 100% of projects achieving their primary output, there was actually a lower level of longer term successful outcomes. An example being that the initiative where we had supported the development of new animal models, most of those had achieved their intended output, but there was very little evidence of longer term outcomes from that initiative. Whereas actually, where there had been a lower level of achievement of the intended output in our biomarker initiative, actually a higher proportion had gone on to interest industry or have those validated biomarkers taken up into other research projects, which I think is, for us, gave us an indication that where we had set the bar somewhat higher with our risk appetite, we actually got better longer term outcomes. There's more detail of this in the report. We'd also discovered some interesting things about the role of industry partners. So we saw that projects with an industry partner involved at an early stage tended to secure more downstream follow-on funding, tended to progress to clinical trials, license the results, and indeed a higher proportion also identified at an early stage that the project should be abandoned. So there were those interesting, interesting inputs from an industry partner. So I just wanted to briefly highlight some of the economic analysis that was done on this set of projects. Another aspect that we could generalize across our entire portfolio was those projects that had identified a strong link to establishing a spin-out company as being the route for commercializing the research assets that they had developed. And in fact, across our entire portfolio, over 130 spin-out companies based on MRC research were identified using the Researchfish returns. And over half of these had originated from just our directed translational research portfolio. We could then, by linking this data to data from a proprietary source called PitchBook, we could look at the investment that those companies had secured and make a valuation of those companies. And those spin-out companies raised over £1 billion, and putting the total value of those companies at almost £3 billion, which was a great result for us. I mean, that value is concentrated in a very small number of the spin-outs, but it gave us some really nice hard financial data to talk to our stakeholders about. Also, another nice result was that we looked at the difference between those that we had funded at the margin through our developmental pathway funding scheme. So what had happened to projects that had just missed out on funding, and could we compare those with the projects that we had just funded under the scheme? And what was interesting was that they were the projects that we just didn't fund were no less likely to set up a spin-out company, but the value of those spin-out companies over the same period was significantly lower. And so we could say from this that the DPFS funding had a causal role in enabling spin-outs to secure equity investment. And we think that this probably, one explanation of this is the the de-risking that that technology's achieved with DPFS funding, which is a managed scheme, has the benefit of an expert advisory oversight and regular interactions with the MRC over. So it's quite a nice demonstration, or certainly an indication of the added value of the scheme that we have running in this space. Just briefly, we also did, we did a lot under this evaluation project, but we also interviewed over 100 influential stakeholders from a range of organisations, both within the UK and internationally. And this was to get a sense of what had the MRC contributed to the national and international research landscape. And we found from this some really positive specific feedback about some of our schemes, but also a more general recognition that the MRC investment over the last 10 years had really helped transform research, translational research culture in the UK, you know, enabling increase in skills, certainly a support for collaboration and so on. So it had been a really a lot of positive feedback from these stakeholders. And some of the sort of quotes from the report on analysis of the stakeholder interviews are on this slide, particularly referring to those managed schemes, the things like the confidence in concept and the developmental pathway funding scheme. We could use some of the data from this extensive evaluation to pick out impact case studies, so more at the qualitative end of things, but scattered with peppered with a lot of nice quantitative data. You know, we've got some good examples of on these two slides, a couple of spin-outs that really represented the largest amount of value in our portfolio, certainly skewed towards advanced therapeutics, which is obviously an emerging area. We had here an example with Orchard Therapeutics at UCL, and also Miera GTX at UCL, which have gathered a lot of investment. So conclusions and next steps. Well, the evaluation allowed us to say that the MRC had certainly achieved what it set out to do over these 10 years, particularly in the innovative managed directed schemes that we had introduced. They had clearly made a substantial impact on the UK life science spin-out landscape, but also stakeholders validated the view that we contributed significantly to changing the research culture towards translation. As I mentioned, you know, obviously translation is a long-term process, and with many projects making good progress, we expect that the impact of this investment will continue to increase over coming decades. And translation continues to be a central theme in our new delivery plan. But what more specifically could we say that helped us to develop our next 10 years of translational research strategy, and what are we going to do to build on this evaluation work? Well, as you can read in the report, this work has given us the evidence base to push forward in a number of ways in developing our translational research strategy. It's giving us some very strong positive evidence to argue to expand the scale and scope of support for translation. And my colleagues in the Translational Research Group are in the process of securing that funding, if there is more funding for public health research in the UK. It strongly supported that, that the close management of directed research projects was quite a successful way to launch new initiatives and to support translation. And it identified some more specific things around encouraging reverse translation and supporting training and career development as well. We also, more specifically about following up the evaluation work, we found the econometric work extremely helpful for us. So we intend to, on an annual basis, update valuations for spin-out companies linked to MRC work, and are actually talking across UKRI at valuing spin-out companies across the whole of UKRI. We also want to mine the interviews for more insights to get the report to publication in September of last year. We had to cut short the analysis of all of that sort of material, and we've got a lot more material to look at in detail, particularly around the enabling and broad projects, which we didn't dig into quite as much as the focused ones. We want to extend the outcome maps to other schemes. We found that extremely helpful using Researchfish data to generalize our results across our portfolio. And we also want to expand that work on risk appetite as well. So as Gavin mentioned, the evaluation report is in the public domain, and in fact all the supporting data as well that we've gathered is in the public domain. There are 7 annexes to this report that you can download. And I'm very happy to take any questions.
Brilliant, thank you, Ian. So if anybody has any questions, could you just essentially use the chat to hold your hand up, and then I will unmute you and you can ask your question.
Do we have any questions?
There is one person. I'm just trying to find the way to. Yep.
Gavin? Yeah, this is Tracy Rankin from the NIDDK. Thank you for that presentation. Very interesting. My follow-up question was, I think, if I recall the slide correctly, 30% of the projects moved along to phase 2, 3, I think. You know, you have to correct me if I'm wrong. I don't have the slides in front of me. I guess I'm wondering what your expectation was at the outset, or was it pretty like, we have no idea, we'll see what we see?
Yeah, so I'm sharing that slide with the outcome map of the developmental pathway funding scheme. I think we you're right that we didn't have any specific expectation. We searched extensively for sort of comparative data from other funders, and no one could provide us with anything that would allow us to form an expectation for the sort of level of progression we should be seeing. So I think this kind of, for us anyway, it kind of sets a benchmark. So we were, I guess, very pleased to see that in this case for the Developmental Pathway Funding Scheme, within the 10-year period, 36% of projects had progressed far enough along the developmental pathway, the development, the translational pathway, to allow us to see that they had moved beyond MRC's remit. So they had secured private funding, they had established a spin out, they had secured an Innovate UK grant, so in collaboration with industry, or they had secured grants from the Department of Health, or secured other public or charitable funds to go to support work at the clinical trial at phase 2B or later. So I think that we feel that that's quite good progression. We expect that because only 18% of projects reached a dead end, and that meant that that the remainder, which is what about 40% or so are still being researched within the MRC's remit at this point in time. I think that we should see greater progression in future. You would expect that. And indeed, some of the things that have progressed beyond the MRC's remit may well lead to more examples of adoption and into the market. So does that answer your question, Tracy?
I think it's a question we all kind of struggle with when we set up a program. A new program is, what are we going to be happy with, and how do we define success, and how critical it is to define that in some hard number expectation at the outset versus waiting for the program to launch. And this is 10 years, so it's a pretty big window before you have a look. I mean, it's a question I could just throw out to the group.
Yeah, how long should you leave things, and what kind of level of progress would you expect? Yeah.
Gretchen, did you have a question? I saw your
Yes, I do, Gavin. And it's easier to ask than, can you hear me?
Yes.
Great. In the US and the work that I've been part of, we struggle with control groups and have a couple of times really been caught up where our the control group did better than the people that were the subject of our evaluation. So I'm curious about the fact that you compared marginal funded to marginal unfunded. Does that mean that you didn't use all of your projects, but just the ones that were closer to the you didn't pick your star projects, but you went to those that were down near the cutoff point?
That's right. We just used those that had just missed out on funding by sort of 1 mark in our ranking scale, and those that had just been funded. We wanted projects that were as near as possible in quality. So the main difference was the fact that one had received a DPFS award and one hadn't.
That could be a solution for us. I'm not sure it would, because when you're looking at research, the ball can bounce different ways. Do you have any notion as to that shows that the projects that ranked really high when they were chosen are also the ones that did well in terms of progress and spin-offs and things like that?
No, we don't. I think that we didn't have sufficient numbers, and that wasn't on a sort of list of things to take a look at. It's an interesting idea. I don't have any idea whether we would find a difference or not.
I would say, if you don't mind, that whilst not looking at the DPFS ones in particular, I do remember a study about 6 years ago for the MRC set that showed that the very highest ranked ones were in fact sort of qualitatively different from sort of the funded, but with a good score. And so there was that, but that wasn't based around DPFS, it was more general. Yeah.
I mean, good. By what measure? That's was that a bibliometric study?
Well, there was a bibliometric component, but there was also across a range of other outputs. Some of that was translational, sort of moving on, and I'm sure there was some external review component.
Yeah. I mean,
I have one other.
It sounds like.
I have one other.
Sorry, go ahead.
Maybe quick question, if you don't mind.
Yep.
I'm wondering if two things really: how the funding mechanism, and whether you tried I guess you maybe did have some experiments on different funding mechanisms and requirements and selection criteria and such. And then I was also wondering about you've stated a couple of times looking at the support for projects as they unfold. And you presented so much material. It was really, really a well done evaluation, but those are a couple of little questions left in my mind.
Yeah, I think one of our conclusions was that as this comes back to the difficulty in comparing like with like, really. I guess we were inclined to say that because we were looking at our directed portfolio and the translational outcomes were so great, and they developed the lion's share, the majority of translational outcomes. And when we tried to identify projects with a translational intent from the rest of our portfolio that didn't benefit from this managed support that the directed programs would benefit from, we probably weren't comparing like with like there. So we probably can't say that the managed approach makes a quantitative difference there, but all of the feedback from the researchers involved was highly positive. So the qualitative feedback was that they greatly appreciated the managed support that they got, and I think that we were keen to highlight that in their report, and clearly argue that managed schemes should be an important part of our portfolio. It's also, of course, the important difference is that we can discontinue milestone-driven managed programs. We can discontinue those awards, so they come to a point where they've been identified as the translational idea is clearly unviable. We can stop that funding, and obviously then redirect it somewhere else. Whereas in a non-directed portfolio, those awards continue. They're not primarily driven by getting translational outcomes. They can continue their discovery science, and so they're very different. They're very different.
Thanks.
Excellent. Are there is there anyone else that wants to ask a final question? So we're getting close to time. Okay. In that case, if I can ask Ian, if you could give a response in 2 minutes or less, what did you find as the most interesting takeaway from this, either methodologically or in terms of approach or in terms of outcome, and how that will affect going forward with future evaluations on the same vein? It's a big question, to be fair.
Yeah, I think I liked the aspects where we could use the detailed information from the interviews to generalize across our portfolio using information that we had across our entire portfolio. So the example being that, we did a detailed look at translational progress using the interviews, but then we found that we could use the information to validate that using further funding, details of the further funding the projects had got, which is a piece of information we have across our entire portfolio, was quite a good indicator of translational progress. So I think that discovering those sorts of things is a really helpful tool for the future.
Multiple methods are always good.
Yes.
Excellent. So we've got a couple of minutes left. People are leaving. I have put a link to Ian's slides in the group chat, and thank you very much, Ian, for agreeing to that, so you can have a look through it. There's a lot of detail. I would strongly recommend that you have a look at the actual published evaluation and the appendices, as it really is chock-a-block full of some really interesting and detailed work that MRC undertook over an extended period of time. So it's a really interesting piece just to look at and see in action. And then finally, thank you everybody for attending today. Hopefully you found it useful. As I said at the beginning, this is the first in a series of webinars, so we haven't got the second one set yet, but we will publicize that shortly. And I hope to see you again at the next webinar. But thank you very much, and I hope you all have a great day.
Thank you, Gary.
Thank you.
Welcome. Bye.